Hello, my name is Laura, and in a bit you'll be hearing from Carla and Julia. We're excited to take you through our Move Munch Mindset campaign, which focuses on combating unhealthy behaviors that can lead to prediabetes and type 2 diabetes. Before we discuss the campaign, let's talk about the issue of diabetes. Diabetes is a metabolic disorder that leads to chronic high blood sugar and abnormal metabolism of carbs, fats, and proteins. This abnormal metabolism and chronic high blood sugar can lead to many life-changing complications, including loss of vision, the loss of a limb from poor circulation, and even death. Luckily though, prediabetes and type 2 diabetes are preventable. Diabetes can affect people from different backgrounds, ethnic groups, and economic statuses. And while everyone suffering from diabetes could benefit from this campaign, we decided to narrow our focus, specifically to the young adults in the low-income area of McDowell County, West Virginia, that are affected with prediabetes or diabetes. You might be wondering why McDowell, West Virginia. Well, we chose this specific location for a few reasons. McDowell County is part of a very large area known as Appalachia. Appalachia consists of a large region in the eastern United States and follows the Appalachian Mountain System. Due to the rugged location, these areas are more isolated, meaning less mainstream healthcare, less grocery stores, and less access to healthy foods. A second factor in our choice is the prevalence of diabetes in this location. Appalachians are 1.4 times more likely to have diabetes than non-Appalachians. And in West Virginia specifically, the prevalence of diabetes is 1 in 10 individuals. Lastly, we saw a need for appropriate teaching due to lack of formal education. Only 27% of individuals graduated from college. Research shows that lack of education can lead to less or no participation in healthcare. Appalachians also usually place all responsibility on the healthcare provider and do not realize the consequence of their own behaviors. Moving forward in the campaign, you'll see that we kept educational level in mind. The behaviors we're trying to change with our Move Munch Mindset program are poor dietary choices, lack of physical activity, and poor stress management. All three of these factors lead to obesity, which is a major risk factor for developing prediabetes and diabetes. We're looking to provide the residents of McDowell, West Virginia, with healthy behaviors to combat the life-changing chronic illness, diabetes. Now you'll hear from Carla about our campaign message.
Thanks, Laura. My name is Carla Miller. We have considered social influencers or insiders of the community to develop our campaign slogan, Move, Munch, Mindset, McDowell. For our campaign, we will take the lead of the people of McDowell and what will serve their communities to build trust and enhance community engagement. Move. Physical activity is an important strategy to use to combat chronic disease conditions like diabetes. Nationally, West Virginia is ranked second for diabetes and second in adult physical inactivity. Appalachians tend to be sedentary and face barriers to physical activity such as built environment. In the McDowell Choices study, physical activity promotion was used to empower citizens in McDowell County by increasing community engagement while addressing the resilience of the community and the environmental barriers it faces. In our campaign, we incorporate outdoor activities like walking, running, hiking along nature trails, and gardening to the largest extent possible. Establishing a walking routine is important to keeping your heart healthy. Munch. Appalachian diet is largely driven by family, community, and traditions. Dietary patterns are related to increased chronic disease conditions such as diabetes. Historically, Appalachians grew their own food by gardening, hunting, fishing, and raising animals. Dietary patterns are largely influenced by social cultural characteristics, systemic poverty and lack of resources such as grocery stores, and resistance to positive health behaviors. Nutritionists need to understand barriers that Appalachians might face and capitalize on the community's strong family ties and resilience when facing adversity. As nutritionists, we can focus on Appalachia's traditional cultural foods by shifting to preparation methods that are healthy. We can build on their interest in gardening and cooking, as well as sharing meals with family and church, while making resources more accessible to support the community. Some resources might include use of community gardens with locally grown food, collaboration with Ag Extension, cooking classes based on commonly grown foods, and cooking tips that instill healthier eating behaviors. Mindset. The Appalachia people value fierce independence and rugged individualism. Their loyalty to family and kin comes first, followed by social ties in their communities, specifically church, and to a lesser extent, school. In developing community resilience, we will consider that mindset contributes to a shared value of health. Some strategies that incorporate a healthy mindset include talking to friends and family members, walking and playing with pets, storytelling, writing, and drawing. The Appalachian community has strong ties to mother's family and kin. Social networks are likely to involve church or possibly school. Appalachians' communication style uses the ethic of neutrality that avoids angry outbursts, assertiveness, or dominance. Appalachians don't want to call attention to themselves or assume authority over another person. Appalachians may not readily open up to outsiders about their health or believe that they have any health issues. Consequently, they may be at the pre-contemplation stage of the trans-theoretical model. A better lens for understanding Appalachians' health behavior would be the health belief model, as it relates to perceptions about health and behavior, as well as perceived benefits and barriers to healthcare prevention. The perceived threats of illness may likely be the motivator for change. The McDowell community faces many divides: geographical, digital, socioeconomic, and healthcare. Appalachia's greatest divide, though, is in their belief systems. Social cognitive theory explains how the person's behavior, and the environment are inextricably woven together. Knowing our audience includes understanding cultural and belief systems, skill level, motivations, and interest. According to Donald Berwick, when the fabric of communities upon which health depends is torn, then healers are called to mend it. The moral law within insists so. In the spirit of considering the moral determinants of health, it is important to establish credibility and trust with the people of McDowell County. The community is one of resilience and strength, but they do face several barriers to healthcare, including cost, quality, and access. Our campaign considers the unique strengths and needs of the community. The product of our campaign initiative is to focus behavior changes that empower our target audience with tools for increased physical activity, ability to make informed healthy choices when it comes to diet, and a great attitude and mindset. The deliverables are in the form of an infographic and brochure. The print media was carefully selected by considering barriers, namely digital divide and literacy level. The price will be free to McDowell County citizens, as we will rely on existing programs, initiatives, and grants like McDowell Choices. Further, we will offer volunteer programs for health, wellness, and gardening, such as Ag Extension services, grants for community gardens, existing prevention and reversal programs for diabetes. The promotion of our campaign will tap into existing infrastructures, such as reconnecting McDowell and food programs in McDowell County to reach our target audience, with the goals of fostering independence, minimizing health risks, and tapping into resources for healthy behaviors. The placement of our campaign flyers and brochures will include food pantries, farmers markets, free public events, churches, pharmacies, and doctors' offices. In the next group of slides, Julia will describe the goal of our marketing campaign and some wonderful graphics that support this endeavor.
Thank you, Carla. Hello, everyone. My name is Julia Heimlich, and we're going to talk about the communication plan for the Move Munch Mindset campaign. The issue we are addressing is the high rate of diabetes in McDowell County, West Virginia. Our goal is to help reduce the rate of diabetes for this underserved community by promoting healthy habits. The program objective is to work with health professionals, such as physicians, pharmacies, and health clinics, to promote healthy habits such as physical activity, or move, healthy eating habits, or munch, and keeping a good outlook on wellness, or mindset. The primary audience are residents of McDowell County, ages 18 to 24. The secondary audience is health professionals, partners, sponsors, and diabetes advocates. This is a list of potential partnerships for the promotion of the campaign. The Department of Health and Human Services of West Virginia recognizes that there are high rates of diabetes and other chronic health issues and promote various programs to help communities. For example, the Dining with Diabetes program is provided for free by an extension service of West Virginia University. This program teaches you how to prepare healthy meals for you and your family. As Carla mentioned earlier, technology is not widely available in McDowell County, so we will have print materials to promote the campaign. Here is an example of an infographic to be distributed by health professionals. The reading level is at 7th grade according to the SMOG readability test. The first section talks about moving your body. The second section talks about eating healthy snacks. And the third section talks about keeping your mind healthy. We've also created a trifold brochure to talk about diabetes and pre-diabetes with tips on becoming active, eating healthy snacks, and having a healthy mindset. Other materials may come from potential partnerships with the National Diabetes Prevention Program, doihaveprediabetes.org, and the National Extension Working Group, the Institute for Family Health, and also Grow Appalachia, which helps to provide grants to build community gardens in rural communities of Central Appalachia.
Those who receive campaign materials will be given 5 questions to answer about their behavior using a smiley face Likert scale. After they've been given materials, they will be given the questionnaire again. Then there will be a 6-month follow-up questionnaire with the same 5 questions. We chose the smiley face Likert scale to obtain honest answers and to limit confusion among readers. The pre, post, and 6-month follow-up will be used to examine the growth of healthy habits among this community.
The first question is about exercise. Questions 2 and 3 deal with healthy eating habits. And questions 4 and 5 deal with stress and water consumption.
We hope you enjoyed our campaign strategy for this McDowell County population. Move, Munch, Mindset incorporates physical activity, diet, and mental state for those with prediabetes and diabetes.